Hey everybody, it's Chris from Chris Beat Cancer, and today I am interviewing the legendary Dr. William Lee. Dr. William Lee is a renowned doctor, scientist, and anti-angiogenesis or angiogenesis expert. His groundbreaking work has impacted more than 70 diseases, including cancer, diabetes, blindness, heart disease, and obesity. Dr. Lee's wildly popular TED Talk, Can We Eat to Starve Cancer?, has garnered more than 11 million views. He's been a guest on Dr. Oz, CNN, MSNBC. He's been featured in USA Today, Time Magazine, Wall Street Journal, The Atlantic, O Magazine, and many more. Dr. Lee founded Eat to Beat Cancer, which is a community of 60,000 plus people who are passionate about using diet to fight cancer. Dr. Lee has held faculty appointments at Harvard and Tufts University. And now I have the great pleasure of interviewing him and sharing his amazing, deep knowledge of anti-cancer nutrition with you. Hello, Dr. Lee.
Hello, Chris.
How are you?
I'm doing very well. Thank you for inviting me to join you. I am an admirer of your work and think that what your message is really very important to the cancer community, both at the patient and also at the doctor level. So thank you.
Thanks. That really means a lot to hear that. I was kind of telling you this briefly before we started, but when I was diagnosed with cancer, I had just a handful of books and had no real access to nutritional science. It was 2004. I don't know if PubMed was even around back then, but social media definitely wasn't. And so when I made radical changes to my diet and started overdosing on anti-cancer nutrition, which we'll talk about the specifics of that, it was really just more instincts and a handful of survivor stories that I was following. And then years later, as I started blogging and when I decided to share my story and go public and try to be helpful to more people, that's when I stumbled across you and realized, wow, like this isn't just luck, right? This isn't just sort of like hippie, hippie ideas. Like there's all this published nutritional science demonstrating that foods have all these amazing anti-cancer compounds and benefits to the body. And so that got me really excited because it validated. I was like, now I'm starting to understand why all the fruits and vegetables I ate helped me recover. So thank you for your amazing research. I'm just so excited to dive in here, but that's my preface to this whole thing. So a lot of researchers, scientific researchers, are, it seems to me, focused very heavily on drug development, right? They're focused on that side of chemistry. How did you, coming up, going through your education and all that, how did you get turned on to nutrition?
Well, my background is rather unusual. I grew up in a family where I had arts and sciences in my background. My mother's a pianist. My father is a medical researcher. And so I always began to appreciate the fact that science leads the way but doesn't give the full answer, and that many times when you kind of hit the brick wall of knowledge, that you have to kind of get creative and look beyond the obvious or beyond what everybody believes is where we are in terms of our current knowledge. And so my own research has always been to look at common denominators. I've always been very interested in understanding what makes things the same, as opposed to in medicine, we often are taught to look at what makes things different. And because of that, I came to this field called angiogenesis. Angiogenesis is a Greek word that basically is very simple. It refers to how the body grows blood vessels, and we need all these blood vessels to feed every cell in our body. In fact, feeding our cells is a kind of nutrition. And angiogenesis is related to nutrition because what we eat actually feeds our cells through our blood vessels. Now that I understood became really important for your heart, for your brain, for developing your muscles if you're young and exercising, or if you're old and you want to stay and have good tone. But I also realized in my research that this same common denominator of health and nutrition could have a dark side to it. And that dark side could come if cancers actually could hijack that defense system of nutrition and grow blood vessels selfishly to themselves. And just to come back to the nutrition and how I got started, I started realizing that, first of all, there was this enormous opportunity to fight cancer by staving off the blood supply. So that became one area of research. My work has been published in many very well-known medical journals like Science and Nature and other journals like that. But I started to realize, as you had mentioned as well, that there was this hidden body, almost invisible body of research that was being done all around the world. And these are articles done by serious scientists who are looking at plant-based foods primarily with the same eye, the same mind, and the same tools that drug developers use to actually study chemicals that would ultimately being developed to drugs. So I started thinking, well, maybe there's a common denominator approach to studying foods using the same tools as we use to study medicines. And so again, this common denominator theme brought me over to the plant world. And I remember distinctly in 1994, I happened upon a paper by a colleague of mine now named Ted Fotsis. He is this remarkable, he's an older guy now, but he's a really brilliant researcher from Greece who studied, I was in Helsinki, and he did this research project when he got to the lab of studying the urine of villagers, both men and women, from Japan that ate a plant-based diet. These were farmers. And he was looking in the urine for any trace of chemicals natural chemicals that would come from plants. And he found this huge spike that became the focus of my attention, because that spike in the urine of the plant eaters was an anti-angiogenic or blood vessel cutting off, tumor starving molecule that's not normally found in the human body. It's found in plants, specifically in soybeans.
Wow.
That opened my mind to this whole idea that we could actually begin looking at the treasures of Mother Nature found in foods that we eat and begin taking a look at not just the theory of what happens, but what really happens in people's bodies.
And I'll define it for anybody that is not clear, because it's a very sciencey word, right? Angiogenesis is the process by which your body produces blood vessels, and anti-angiogenesis blocks the formation of blood vessels, which for a tumor is a very good thing. And so that's kind of what your research centers around, is finding these compounds in specific foods that actually help your body block the formation of tumors. And so my understanding is, and please correct me if I'm wrong, is that a tumor can really not grow much bigger than, I don't know, the head of a pen or something, or the head of a pencil, whatever, a very small size, without forming new blood vessels. Is that right?
That's right. So here's the remarkable thing that we are learning about cancer, because understanding the disease actually helps us understand how we might be able to prevent it and how we might be able to stave it off if we have it, no matter how you approach it. And here's what we're really learning about cancer is that, the human body is made of trillions of cells that are continuously dividing. It's how we get bigger, and that's how we stay, looking as vital as we are, and our organs are functioning as we have lots of cell divisions that are happening. And cancers form when there are mistakes that occur when cells divide. In fact, it turns out that there are mistakes that are being made all the time in the body. About 10,000 mistakes occur in our DNA every single day for healthy people as well as people who are not healthy. And those little mistakes can lead to pinpoint cancers that can grow. And once those pinpoint cancers grow, you're right in stating that they can get up to about 2 millimeters in diameter. That's about the size of the tip of a ballpoint pen. And then they can't actually get any bigger by themselves because they don't have enough oxygen or nutrients. They are stuck. Imagine being on an island without food. You're probably not going to get any bigger or more vital. Your muscles aren't going to grow anymore if you don't get any more nutrition. And that's the size that they stay. And what we now know is that at that size, usually your immune system wings by, finds them, and just takes out those tiny microscopic cancers. So we all have cancers in our body forming all the time. Children, healthy people, athletes, older people who don't have cancer. And what it is that they're microscopic, and our immune systems, if properly defended, actually can wipe them out all by themselves. Now, what happens is that occasionally some of these cancer cells get really smart, and they can outwit the immune system. And then on top of that, they begin making this protein. These are growth factors that are the same ones that our body uses to get their own nutrition with blood vessels, and they hijack those blood vessels to grow towards themselves. And once blood vessels hit a tiny microscopic cancer, our research has shown that the tumor can grow up to 16,000 times in volume in only 2 weeks. So it can explode in growth if you are feeding it, and that makes total sense. So anti-angiogenesis is really trying to prevent tumors from growing their blood vessels, and if they've already been grown, which is what happens in most people who have already been diagnosed with cancer because the tumors are already big enough to be found, there's still an opportunity to starve that cancer, choke it up by cutting off its blood supply.
So if a tiny tumor can grow, like you said, up to 16,000 times its size in a matter of a few weeks,
yeah.
does that change the way some people are looking at the progression of cancer growth? And what I mean by that is, a lot of times cancer patients are told, well, this has probably been growing in your body for 10 years. But I also know that people will have a mammogram one year and then the next year may or may not have a mammogram, but they find a lump. And it seems like that thing popped up overnight.
Yeah.
So do you think cancers are growing faster than maybe people are told?
Well, there's little mini invisible cancers everywhere, and they just get taken care of. They're like pimples that form. Mm-hmm. And just like a pimple, they're not a big deal. However, they're cut off from a blood supply. And so essentially your immune system wipes out all those little pimples. But once those one tiny little tumorous cancerous pimple can get a blood supply, so let's say it's growing quietly, invisible, but once it gets angiogenesis, it'll actually be able to rocket off. And so I think that phenomenon that we hear about, that it's been probably growing 10 years, I don't know if it's really been 10 years. It may have been kind of coming and going, and your immune system has been wiping them out. But at some point, the reason that we go from being kind of not having cancer to suddenly being diagnosed with cancer usually is a really steep, fast, exponential growth, an explosive growth that brings it to our attention first as people, right? I mean, sometimes doctors will go ahead and find ahead of the curve a cancer that's been lurking, but oftentimes somebody's bringing themselves to the doctor because they notice something that's not normal, and that's usually that big explosive growth that actually does it.
Yeah, so it's possible that cancer could be there for many years, microscopic and not growing at all, and then something changes, and then it quickly starts growing. That's really fascinating. What do you think we're doing as a culture, just say as Americans, that is promoting cancer growth in our bodies dietarily? And then what are the dietary solutions?
Yeah, well, that's a big question, because we do know that we're starting to notice in our own communities more and more people seem to be diagnosed with cancer, and we're seeing in some cases increased evidence for increased rates of cancer. And while the mortality from many cancers seems to be plateauing, in some cases declining a little bit. I think that our own human experience is that we seem to be seeing it everywhere. And that's, I think, what most people who, are your listeners are going to be keeping in mind. And I always say as a doctor, regardless of what the rate of cancers are, the statistics, if it's you, it's 100%. And so that's what really matters, I think, to people who are paying attention. So now, you've asked another big question, which is like, what are the things that are happening in our culture that can encourage cancer growth? A couple of things. I mean, I think that we've become an industrialized society, and we're more and more exposed to toxins in our environment that actually are harmful to us. The biggest toxin that harms us and is cancer causing is, in fact, solar radiation. When our greenhouse gases, dissolve the ozone layer and the sun shines in our skin, it damages our skin, it mutates the DNA, it creates those little tiny microscopic cancers, and our immune systems have to work harder and harder to actually fight off those tiny little tumors. A recent paper actually showed that, if you go out in the sun, let's say to a beach, and you then come inside and you think you're out of the sun, that actually the energy, the radiation from the sun is stored in your skin cells, and for 3 hours after you're indoors, it's releasing that energy and still causing damage. And so
Wow.
just, living on the planet, but then, I think our society is making it more and more difficult. The toxins, the pollutants, the chemicals in the environment, they clearly create an assault on our defense systems. I think that a lack of exercise, I know that there are many people who do exercise now, but I think by and large there's a lot of people who are still not exercising regularly enough. We know that a lack of exercise actually weakens your immune system. It actually helps you gain your weight, and obesity actually is another contributor to increased risk of cancer. Of course, smoking and alcohol, and even HPV, the human papillomavirus that you hear about, that actually is starting to increase the risk of cervical cancer and cancers in the mouth and the throat. So again, I'm looking sort of just on an environment around us. We're in this toxic environment in general that is very hazardous to our health defenses. And that's gotten me really interested in understanding better how does our body normally defend itself, and how can we help stave off cancer more effectively. And that's where food comes in.
So you're saying, it's increasingly becoming more and more important that we boost our body's own natural defenses, right?
That's right. That's
right. I totally makes sense to me, and something I talk about all the time. It's interesting. This week, one of the big news stories in the cancer community this week is the fact that apparently the EPA has been suppressing a report about how pervasively toxic and cancer-causing formaldehyde is. And they have this report that is known, but they're not releasing it. And so there's this sort of, there's some controversy like brewing about this report and why they won't put it out. And I guess insiders know what the report says or whatever. But formaldehyde is released by, so many of the products we use contain formaldehyde. I mean, furniture, fabrics, upholstery, varnishes, like cleaning products. And it's linked to leukemia, lymphomas, and other cancers. It's really toxic. And again, just one of the many toxic things, but you reminded me of that.
Right. I mean, I think the message that is being clearly appreciated is that we're surrounded by things that can provoke the growth of cancers in the body, and we need to do everything we can to boost our own shields. Our body's a fortress, and just like any medieval fortress, there are lots of ways that have been developed over time to try to defend itself. Angiogenesis, which helps feed the cells of our body with nutrition, actually has its own ways. The body can actually, by itself, stave off blood vessels from growing into tumors. But if you eat foods, you can boost that effect. But there are other defense systems as well. For example, our immune systems are powerful ways of actually protecting ourselves against cancer, because they're the ones that wipe out and clean off and dispose of those microscopic cancers. So you've got angiogenesis, you've got our immune system, the microbiome, the gut, the bacteria in our gut, the healthy bacteria, we've now become to appreciate is super important in terms of communicating with our immune system and even our angiogenesis system. And so our gut bacteria actually turns out to be one of our cancer defense systems. And if we feed our gut bacteria and make them happy, they can actually help to boost our defenses as well. And then finally, of course, our DNA has to be protected. And then what's really interesting is that stem cells in our bone marrow also are one of our defense mechanisms, because we are regenerating healthy tissue, non-cancerous tissue all the time. And so how do we continuously nurture those health defenses is something that I'm working on now. And really, the take home is that it can start with food. We can build our defenses up. And it's easy because we can choose foods that are all around us. It's not rocket science, it's knowledge.
We've been dangling the carrot, so to speak. So let's talk about the best anti-cancer foods.
Right. I have a long list of cancer-fighting foods. Your listeners can find them easily on the internet by coming to eat2beat.org. It's a site that you just sign up for, and it gets you right to free all this information that we've gathered over years on foods and the evidence that they can actually help fight cancer. But I wanted to, kind of tell you the ones that I think are standouts. So we've heard about green tea being healthy because tea contains antioxidants. Actually, tea contains hundreds of different natural molecules that are found in the tea plant. And most of these natural chemicals in the tea bush, actually, that grows, are designed to protect the plant. They're the defense system for the plant. They help to resist insects from eating them. They help to attract bees to pollinate them. And when we brew a cup of tea, and drink that cup of tea, those natural defensive chemicals for the plant have another job description. They start to defend our own cells. One of those natural molecules called EGCG that you can find easily mentioned on the internet actually is anti-angiogenic. So it actually cuts off the blood supply to tumors. And so if you look then at the evidence, the scientific evidence, and then you correlate it to these large population studies, and that's really how we do it, is it's not good enough that it works in a dish. It's not good enough it works in a mouse. And that's really oftentimes where most cancer researchers stop their work. We take it to the next level to say, in the public, in large populations, the real world, real people living real lives, is there any evidence that connects the intake of green tea, for example, with lowered risk of cancer? And the answer is yes. Green tea, drinking anywhere from 2 to 4 cups a day, which is routinely done in Asia, and not big mugs, but cups. These are small cups, can reduce the risk of colon cancer, breast cancer, liver cancer. They all have epidemiological evidence for having this benefit. So tea is one of them.
I had green tea this morning.
Well, that's a couple of little tips about drinking tea that we've done our own research on is that some people put dairy products in their tea. The old English tradition of putting milk in your tea. That's not what you want to do if you want to starve your cancer. Milk actually in a tea will precipitate or bring the natural chemicals down to the bottom of the cup. And so then you're not getting the benefits. You want to actually drink tea straight. Here's another little tip about tea. And again, I'm writing a book right now called Eat to Beat Cancer, The New Science of How the Body Heals Itself. It'll come out next spring. Actually, if you sign up for eat2beat.org, you'll be the first to hear about it. But we're actually including a lot of little tips. So, for example, a lot of people drink tea at too hot a temperature. You boil the water, you pour the tea, you start sipping it right away. drinking boiling hot tea is associated with an increased risk of some of the cancers of the esophagus. You want to let it cool down for about 10 minutes. That's about the right time you steep the tea, the good stuff comes out, and then it's at a safer temperature to drink. So again, it's not just simply picking the food, it's also knowing a little bit more about what to put into it or not to put into it and how to actually handle it before you actually eat it.
Do you have any opinion on matcha green tea versus just green tea leaves in a bag?
Yeah, so it's very interesting. We have also done research to compare different teas. And matcha, which is a Japanese green tea, is very grassy, and some people really love it. Chinese tea is often a tea that's rolled up and put into the bag. We actually found in one research comparison study that the Chinese tea was more powerful from a tumor-starving perspective than the Japanese matcha tea.
Interesting.
Here's the other surprise. We actually found that a black tea, which most people say don't have much value because it's been oxidized, turns out that the black tea was among the most powerful teas, more powerful than green tea when it comes to anti-angiogenesis. So Earl Grey actually was quite powerful. So
wow.
We can't make assumptions. We just need to be able to go out there and look at the data, which is something I'm really bullish about emphasizing, is that there is research, as you said. It's out there. I'm writing this book to give the public the data, but everybody should actually do the research themselves. And in your own podcast, what I love about it is that you go through the research and you try to explain it to people.
I do my best. I'm not a scientist, so believe me, it is hard brain work for me to, not coming from a scientific education or background, to break down some of this stuff into, language that anyone can understand. But that's really interesting about green tea and matcha, because I've been consuming matcha for years, and I guess I wrongly assumed, or maybe I read it somewhere or whatever, but that because you're consuming the whole leaf, that maybe there's more benefits to that, right?
Right.
So yeah, that's really interesting.
A couple of other foods that might be notable is nuts, tree nuts, like walnuts. We know that there are polyphenols that are found in tree nuts. And when you eat those polyphenols, they're anti-angiogenic and they get into your bloodstream. And again, when you take a look at real human populations, you can find that the consumption of nuts lowers the risk of many different types of cancers, from prostate cancer to colon cancer to breast cancer. What's really amazing is what we're beginning to appreciate about nuts. It turns out that nuts are an incredible source of dietary fiber. And when you have dietary fiber, when I went to medical school, we were just taught that fiber is kind of good for making your bowel movements regular and helping to fight constipation. And that's probably part of it. But in fact, dietary fiber, like you would have in a tree nut, feeds your microbiome, the gut bacteria. They love fiber. And when the gut bacteria starts to digest that fiber, they metabolize it. They make metabolites that boost your immune system that's cancer fighting. Last year, there was a pretty amazing study that was presented at the American Society for Clinical Oncology, which I know is a meeting that you cover from time to time. And I don't know if you heard about this study involving patients with colon cancer, but they found that patients that were undergoing regular treatment for colon cancer by the regular medical system, that if they ate 2 servings of nuts a week, they decreased their risk of death or recurrence actually by almost 50%. And so here's something that was just always in front of us that the doctors don't tell you about, that researchers are doing, and now the oncologists are running the actual research and finding out there is a correlation between nuts and outcomes. And what I think is that this is partly due to the anti-angiogenic molecules that are substances that are in the nuts, but also due to the fact that we're feeding our gut bacteria and they are helping our immune system fight off the cancer as well.
I did see that study and got really excited about it and wrote up a little blog post summary about it last year. And the thing about nuts is you really do have to be deliberate about eating them, because if we look at the standard American diet, if you look at pretty much any fast food restaurant or even a nicer sit down restaurant, by and large, nuts are not in the menu. They're not in the breakfast options. They're not in the lunch options. They're not in the dinner options. Nuts are so rarely consumed in any American restaurant that, we eat out a lot, and Americans are not eating nuts.
Yeah. Well, you're bringing up another point going back to society. Our bodies as humans evolved over tens of thousands of years from a much earlier stage of evolution of hunter-gatherers, right? So our bodies evolved to actually perform by picking things that we could find on the ground or from shrubs and eating them. That's how our organs actually evolved. We ate, back in the hunter-gatherer days, humans really ate mostly whole plant foods, whole grains they could find. They ate nuts when they could find them. Very, very little animal protein. I mean, it was rare when you came across, maybe a carcass or something, and then everybody descended and gorged. But then it would be weeks and maybe months before you found something like that again. What we've done over the course of human history, particularly I think in Western cultures, the Western diets, we've inverted everything, where we have mostly animal protein and we have very little plant-based, fiber-based intake. And so that's, I think, the explanation for this paucity, let's say, or a lack of nuts that we actually see. But that doesn't mean that we have the knowledge why we can't do it. I mean, you don't have to wait to sit, in a lounge someplace for somebody to hand you a little thing of nuts. It's the easiest thing to go out to the store, and almost any grocery store will actually have a nut. If there's one packaged food that actually is good for you, it's going to be a bag of nuts.
Yeah. I love that you brought up the hunter-gatherer thing too, because there's sort of this fantasy narrative that has been propagated that hunter-gatherers, basically only ate bacon, right? They just ate meat all day and then like a little bit of nuts and berries. But all of the studies on the few remaining hunter-gatherer populations on Earth, like the Hadza, for example, have revealed the opposite to be true, which is what you said, is they actually subsist off of root vegetables and plant food and fruit, and eat very little meat because they have to hunt it and kill it, and it's difficult. And the hunters in the tribes will often go out for days at a time and often come back with nothing. Right. And so when they do come back, yes, everybody's excited and they eat it. And sometimes it's just a little, a muskrat or something, right? It's not anything of significance, not enough to sustain you. So, it's the narrative's been twisted to justify this excessive amount of meat consumption because our hunter-gatherer ancestors did it. And there's also the other assumption attached to that, which is that they had exceptional health and long life, which we don't have any evidence of either. But it's something that I'm constantly arguing and debating with people about.
Well, I think that there's something very healthy that the discussion's out to really challenge the way that we eat. That's probably the most important thing, is that people are questioning kind of the things that they may have grown up with and asking, is there a different way? I think that that's a start to actually changing our behaviors as a society. Here's another food that actually you might be interested in. We all know the Mediterranean diet is actually very healthy overall for your heart, your brain, your weight. It lowers the risk of diabetes. And there's also lower risks of some cancers actually associated with particular ingredients that are found in Mediterranean foods. And one of them that I think is the most convincing is the tomato. So what's interesting about tomato is that it didn't start in the Mediterranean. Tomatoes were brought to the Mediterraneans from South and Central America. They came from Peru, like potatoes came from Peru as well.
Really? I did not know that.
Yeah, so there was no tomato sauce in Italy.
Yeah, and it's such a staple now.
Exactly. But and in fact, when tomatoes were first brought to Italy, they were considered more ornamental, and they were rarely eaten. And I want to kind of point out a myth that's occurred about tomatoes and nightshade and poison and all kinds of stuff that is also in the literature. That when the tomatoes were first brought to Italy, they were placed onto trays, lead trays, and the acid in the tomato would leach out the lead. And when people ate tomatoes, they would actually get sick, literally lead poisoning. And that led to this idea that maybe tomatoes were toxic. And so the wealthier people who could afford tomatoes had them as ornaments. They just kept them, put them as nice little decorations around the house. But of course, the peasants who couldn't afford, fancy silverware and flatware and plates, they just kept them out in the sun on wooden shelves and windowsills, which is how farmers do it and how you're supposed to actually store a tomato. And that's why it's really the rural peasants that actually began developing in the Mediterranean culture the idea of tomato sauces. But here's what's amazing. Tomatoes actually contain a natural bioactive chemical called lycopene. Now, most people have heard of lycopene because supplements are, like you can buy lycopene supplements.
Of course.
But it turns out that lycopene is a powerful anti-angiogenic molecule. So it actually starves cancers by cutting off the blood supply. How do we know that actually works in people? Well, there is a really famous large epidemiological study conducted out of Harvard called the Health Professionals Follow-Up Study. It's about 70,000 men followed over 20 years. And when they looked in that population and saw what they ate and correlated with their outcomes, they found that eating tomatoes was associated with a reduced risk of prostate cancer. In fact, men that ate 2 to 3 servings of cooked tomatoes a week, each serving being about a half a cup of tomato sauce, so that's easily put on your pasta or whatever, would decrease the risk of prostate cancer by about 40%. So now, in the men that did get prostate cancer, they also looked at their actual cancers because they could look at them under the microscope. And they found that in those men who ate more tomato sauce per week, that the prostate cancer under the microscope was less aggressive and had fewer blood vessels feeding the cancer. So that's almost a smoking gun that connects, the tomatoes in a good way, the tomatoes with decreased risk, and the more tomatoes you ate, the less aggressive the cancer was, and you saw fewer blood vessels. So I think for men that are concerned about prostate cancer, there is really strong evidence that tomatoes can actually reduce the risk. But it's got to be cooked tomatoes. And why does it have to be cooked?
I know why. I think I know why.
Okay.
So I had read at some point, picked up this tidbit that cooking tomatoes increases the lycopene by maybe 6 or 8 times or something, or the absorption of lycopene, or maybe it changes the molecule. Am I close?
Yeah, all of the above. You chose answer E, which is all the above. It turns out that if you eat a tomato off a vine, most tomatoes, and they're delicious, a great source of vitamins and other phytonutrients, the lycopene that occurs in Mother Nature is very difficult for your body to absorb. In fact, most of it passes right through. But if you actually heat the tomato, simmering the tomato will actually change the chemical structure into a form that your body loves to absorb. So it increases the absorption of the lycopene. And if you heat it with some olive oil, because lycopene is what we call a fat soluble, or it can dissolve in fat substance, when you eat that, when it's got some olive oil in the tomato sauce, it helps your stomach absorb it even better. So Mediterranean diet, tomato sauce simmered with olive oil starts to make a little more sense. And this is where the science and the culture kind of collides together, converges together, and helps us understand why eating tomatoes and having tomato sauce might be beneficial.
What about ketchup, though?
Well, okay, so I think that homemade ketchups are probably just fine. It's, in general, processed foods are the ones that we need to be careful about because we don't know how they're made. I think that, as somebody who is very careful about what I eat, and I care a lot about trying to prevent cancer in my body, it's all about making good choices. And when you have the choice of knowing where your food came from and how it was prepared versus not knowing, I go for the knowledge of how it where it came from, and how it was prepared every single time. So, these are three good foods that I think are top. Green tea, nuts, tomatoes. There's a long list of other ones as well.
What about cruciferous vegetables?
Well, okay, so cruciferous vegetables, which are your green, crunchy vegetables like broccoli and cabbage, all phenomenal because they contain natural molecules as well. It's almost zoology, kind of like going out and finding out and discovering all these different molecules and putting them in the right classification. But there are sulforaphanes, so that's what makes Brussels sprouts and cabbage kind of smell. They have that strong taste. It's kind of a sulfury smell. That's a natural molecule. That is a biochemical that Mother Nature put in the plant that actually is anti-androgenic as well. So when you eat broccoli, cabbage, and those kinds of cruciferous vegetables, chicory, you wind up kale, you wind up actually consuming the the sulforaphanes. Now, one thing again about technique, it's God is in the details often. When you eat vegetables and you chew the plant, if you were to eat a head of broccoli or a broccoli top floret and just crunch it a couple of times and swallow it, actually most of the benefit is still stuck in the fiber of the plant and will pass through you. If you chew the plant, what happens is that you will burst the plant cell. So if you keep on chewing, you know how our moms used to tell us to chew our food? Well, your saliva and the crunching of the actual plant cells will release those sulforaphanes, and so you remove them from the inside of the plant. And now when you swallow, it goes right into your bloodstream. So again, it's not just eating the plant, it's actually how you chew it as well that can actually make a difference.
And chewing causes the that enzyme reaction, right? That creates
exactly to come right out. Yeah, you know a lot about this.
I'm pretty geeky. I'm pretty geeky about this stuff. Yeah. Right. I also read some research that obviously chewing is very important with cruciferous vegetables because it creates sulforaphane, but also that you can chop them and let them sit for 10 to 15 minutes before cooking, because cooking reduces some of these the potency of some of these anti-cancer compounds. But if you chop them up first, let it sit while you're doing some other food prep, and then cook, it preserves the sulforaphane.
That's right. What you're doing is you're actually releasing those sulforaphanes out, making them more concentrated, more available for your body. So that's absolutely correct. So most of the foods that we associate with good health that are plant-based have reasons that we're beginning to unravel and discover of how they actually can hit the targets that we want to help prevent or even treat cancer. And I think that if any of your listeners actually are people who are struggling with cancer, the one thing I know is that you asked how did I get into this? I was a VA doctor once, and I felt very strongly about my service to the people who served our country was a big responsibility. That if we could do better care for the people who were committed themselves to helping us. And I knew that these people, when I saw them, were in their 50s and 60s and 70s, and they were terribly overweight, out of shape. They had terrible diseases, heart disease, diabetes, cancer. And yet something that always struck me when I hung up my white coat and left the office every day was that when they were 20 years old, they were cut and buff. They were in the best physical shape our country had, which is how we had them as our armed forces. And so something that always bugged me was like, what happened between people that were in total shape and people that wind up, totally coming out of shape? I think the same thing is true when you look at professional athletes. If you look at football players, they are in such great shape during the season, but then fast forward 20 years and their body changes. And so it made me realize that in addition to genetics and other things, that their diet probably contributed a lot. And as I was as their doctor, examining them and too often handing them a diagnosis of a disease that nobody wants to hear about, they would ask me, how long do I have and what do I get treated with, and how bad is it? And then I would tell them, and then they would be on their way out the door, and every single one of them, without fail, would turn around at the very end and say, "Hey, doc, one more question. What can I do for myself? What can I eat?" And I realized I didn't have the answer. I was never taught that in medical school or training. And so I realized that was something that I really wanted to pursue. And that led me on this journey that I have right now, which is all about trying to understand better what foods actually can be helpful to us. Do I have an answer that I can give to people who are struggling with a disease like cancer? And is there the evidence, the science that makes it real and not wishful thinking?
Well, nearly every doctor is getting those questions, is getting those food questions, especially in the cancer community. And the tragedy is that I hear this over and over and over, is that oncologists are telling cancer patients, go home and eat whatever you want, and you really need to eat high-calorie food, so ice cream and milkshakes and pizza, because we're worried, we don't want you to lose too much weight during chemo, so eat these high-calorie, just complete junk food. And yeah, they basically give them permission to go home and just continue eating a horrible Western diet, the diet that contributed to their disease in a lot of cases. And working at the VA, I'm sure you saw the hospital food at the VA. I'm sure it was deplorable. And you may not know this about my story, but I had colon resection surgery, and the first meal they served me after cutting out a third of my large intestine was a sloppy Joe.
Oh, boy.
Which, speaking of the VA, right, pretty much the only place you can get a sloppy Joe is if you're in the Army, right, or in prison.
Well, look, here's something positive that I'm starting to see, is that even within the medical community, we are beginning, I think it's just beginning, but we are starting to have this conversation among doctors. When I was in medical school, believe it or not, or I had a hard time believing, doctors were still smoking. They were, talking about lung cancer to their patients and then going out and having a smoke in the parking lot was ridiculous. I think, fast forward 25 years, and now we're beginning to see doctors are themselves beginning to look in the mirror and say, what am I doing to myself? And, it's hard to preach what you don't practice. And so one of the things that I'm very committed to doing is trying to educate doctors and have them rethink everything that we've known about diet, which is why I'm writing this book, is hopefully to try to get the message out. And, your podcast is a wonderful medium as well, and I'd love to help you continue to get your word out as well. But this idea that we should be thinking deliberately, consciously about how we live our lives, and diet plays a really, really central role. We don't want to go for wishful thinking. We want to go for evidence. We want to look for the science, the data, the same way that we would for any type of intervention that could be helpful to us. And so, I think that we're slowly starting to change the mindset of the medical community. We've got a long ways to go, but I think that we will get there. I was part of a conference that I helped to convene last year in Paris that you might be interested in. It was called Rethinking Cancer. And it was prompted by a colleague, a friend, and an advisor of mine named J.J. Trochon, whose story is well known because he's been in the media before. But he's an airplane pilot who was diagnosed with kidney cancer 14 years ago. And he used diet to completely overcome his disease. Many years later, and because he used anti-angiogenic foods as well, many years later he approached me and he said, hey, Dr. Lee, I would love to be able to help bring the patient's view of things that we have questions on but that doctors don't address. I'd like to bring that into a medical conference. Could we just create a new medical conference? So we created this. And because he's from France, that's why we had it in France. We called it Rethinking Cancer, and I collaborated with a colleague of mine named Dr. Bernard Escudier, who's also a very open-minded oncologist. And we said, let's create a cancer research meeting, and the only rule for this meeting is that you can't talk about chemotherapy or radiation or surgery. So if you remove all those topics from a cancer research meeting, what are you left with? You're left with diet. You're left with psychosocial. You're left with sleep. You're left with stress. You're left with a lot of these things that we all have questions about. But we brought the world's best researchers to the table. And one of the things that I wanted to share with your readers that I think would be really interesting is that, as you know, immune therapies is widely touted as one of the big breakthrough areas. And some of them actually work really well. Like President Jimmy Carter had a melanoma that had spread to his brain, and he was able to get an immune therapy that melted his tumor away. What the therapy didn't melt his tumor away, his immune system was able to attack it. I also was fortunate. My own mother actually had a cancer that also was able to be responsive, or her body was able to respond to immune therapies. But actually, many people who are treated this way don't respond. And so it's one of the big dilemmas, like, how do you know who's going to respond, and how can we make people respond better? So, because obviously, ideally, we don't want to use medicines to treat cancers. We want our bodies to treat the cancer. That would be the ideal thing. Well, it turns out that in this presentation that was given at this Rethinking Cancer meeting, Dr. Laurence Vogel, who works at the Institut Gustave Roussy, looked at patients who were receiving immune therapies and found that the difference between the people who responded, had their immune systems able to wipe out the cancer or shrink the cancer, versus the people for whom it didn't work, was based on the presence of one gut bacteria.
Wow.
And that bacteria, they could find it, in the stool, is a bacteria called Akkermansia. If you had this bacteria in your gut, in your colon, you actually would respond. And if you didn't have it, most of the people who didn't respond didn't actually have it. It turns out you can't have that bacteria, you can't eat it as a probiotic. The only way you can get that is by eating foods that can actually help to nurture the growth of that bacteria naturally. So here's another food that calls to mind is pomegranate juice. It turns out that the elagitannins, the natural tart substances that are present in pomegranate, actually feeds the bacteria, that Akkermansia, that actually helps prompt your immune system to fight cancer. Cranberries can also do the same thing. So again, this is new research that's coming out that only was published a few months ago that is changing the way within the mainstream medical community, opening our eyes that, the things that we used to kind of like the doctors used to poo-poo away, we have to really take seriously. So again, think about the patients who get antibiotics as a matter of course during their cancer treatment. That might be wiping out some really valuable bacteria that's helping our bodies. Or chemotherapy itself actually lowers our immune system. What can we do to push back against that? How can we right the scales in our body so our immune system can be as fortified as possible? It turns out that eating some foods can do that.
You brought up so many things I want to touch on. One of the most, I think, underappreciated side effects of chemotherapy is the destruction that it causes in the digestive tract, in the intestinal tract, and that it wipes out so many good bacteria. And that's so important. It's not talked about enough. I'm so glad you brought it up. My mind is kind of blown about the pomegranate thing and that specific bacteria that improves immunotherapy treatments. I mean, that is so amazing. I thought for sure you were going to say it was Pepsi, but are you going to do the conference again?
Yes, we're planning to do the conference again. There's a couple of conferences that we're going to plan to do as well. And so it's all in the planning stages. You'll be the first to know when we get it together.
Oh, I'd love to know. I'd love to know about it. And I remember hearing about the Rethinking Cancer thing. I even looked at, I came across my desk or whatever, and I looked at it and thought, wow, that looks pretty interesting. And now I'm kind of kicking myself because I should have dug a little deeper and just gone next time. Yeah, that's great. I just, I said this a minute ago, and I didn't actually finish the point I wanted to make, which was so many doctors obviously are confronted by or asked about nutrition by their patients, right? And they don't have any answers. And they just shrug their shoulders, and they either give them what I would say is bad advice, or they just shrug their shoulders and say, I don't know, which is where you were years ago. And it's just so commendable that you are the kind of person who was not okay with not knowing and was not okay with just saying, I don't know, next. And, you went on a quest to find answers. And there's only a small contingent of medical professionals that have the same mindset as you, that have, either walked away from conventional treatment or just said, hey, there's so much more that we can do to help patients, right? Diet and lifestyle medicine is huge. It's the missing piece here, even if a patient is getting conventional treatment. And I do agree with you, and it is nice to see that things are changing. Like there's a large association of plant-based MDs now, more than ever. Their diet and lifestyle medicine is just growing and growing every year. Even hospitals are starting to serve organic food in some hospitals and things, and have salad bars instead of they probably still have the hot bar with the meatloaf and whatever, but it's encouraging and exciting to see improvements, right? Improvements coming and things changing, and I think a lot of it's driven by public demand, the public's being more educated on nutrition, and doctors are part of the public. And so they're seeing this stuff too in their off hours, right? And they're, the practice what you preach thing is such a key component, I think, because it's like you said, the doctor who smokes and is telling people, well, you have lung cancer. And there's a factor that a phrase I coined that I think is one of the most pervasive problems in medicine and in the health and wellness community is what I call meat lover's bias. And so the person that loves meat, and the doctor or physician or practitioner, or even just like the wellness influencer that loves to eat meat 3 times a day, is not interested in looking at studies for the most part that show that meat consumption leads to a lot of diseases in excess, right?
Right. Well, this is the whole thing about looking at data is the bias of interpretation. And so I would say that, there are so many research studies that have been published and are still underway looking at the benefits of food. That's what I call the signal, looking at the data. But there's really a lot of noise out there because, even well-intentioned people trying to interpret the data can come at it from their own perspective, and then things get confusing. So one of the things that I think that, you and I share is this commitment to really try to make sure the signal rings true and is really more easily seen. And hopefully people will start to focus on signal and kind of ignore the noise.
Yeah, and it doesn't help the fact that there's so many industry published studies. There's so many studies that are published with intention to protect industry interests, like the tobacco companies publishing studies saying that cigarettes didn't cause cancer decades ago, and big ag and the big meat industries and things constantly publishing studies trying to sort of make claims about everyone needs to eat beef every day or whatever. Yeah.
Well, my view is this: the data doesn't lie and tells the truth. One of the most, there's an old saying that was used in a lecture for my medical school graduation. It was themed, "In God we trust, all others bring data." And I think that that's really how we should be able to look at all the studies concerning cancer research and the role of diet is, let's look at the study, let's look at how it was designed, let's look at the results, and let's look at how it was interpreted. Because if we have enough minds looking at it, I think truth tends to reveal itself. And that's where we need to go. And I think we're beginning to find new truths about our food and our food supply and our food systems and the decisions that we make and how we educate our families about the foods that we eat. And going back to this whole idea of culture, I think that we're at this moment of time in society where we're starting to question what we're doing. And I think the next phase we're going to move into is trying to figure out what do we do about it.
Yeah. You mentioned epidemiology earlier and the value of looking at large populations of people and look at their rates of disease and look at the way they're living their life and what are they eating. And obviously green tea was a significant factor, but there's another one in Asian countries too. Tend to produce, they tend to consume a lot more mushrooms, right?
Right.
Talk about
Yeah.
mushrooms.
Well, so mushrooms are really interesting because, first of all, if you prepare the mushrooms the right way, they're tasty, and there are so many different types of mushrooms that are out there. In America, we tend to be stuck with just a couple of mushrooms, the white button mushrooms, which, by the way, are also very valuable. They build our immune system. So white button mushrooms are actually quite a good mushroom to have. We also have looked at mushrooms. Mushrooms contain a natural bioactive molecule called beta-glucan. Beta-glucan actually stimulates your immune system, and it actually is also anti-angiogenic. So now you have two benefits wrapped up in one. And it turns out that the beta-glucan is distributed all throughout the mushroom, and there's a lot of dietary fiber in a mushroom as well. But the part of the mushroom that actually has the most, we usually eat the top of the mushroom, right? And when you buy a mushroom, you cut off the bottom and throw that way and just cook the tops. Turns out that the stipe, or the stem of the mushroom, is where a lot of the goodies are. And so as we do this research, we start to realize that maybe there's even a sustainability, better for the planet. Let's not waste our food. Maybe we should be eating those mushroom stems. They could actually bring some benefit. So mushrooms are an incredible way of actually getting soluble fiber, helps feed your microbiome. Getting beta-glucan builds your immune system and is anti-angiogenic. And, the mushrooms that we tend to find in the grocery store, we automatically recognize white button mushrooms. But I think that if you look at a mushroom, if you go online and just look on edible mushrooms and then go to the store, you'll realize that, in fact, there are some other mushrooms out there like shiitake mushrooms and portobello mushrooms. And there's it's a treasure trove of tasty morsels that you can find. I'm a big fan of encouraging people to eat mushrooms.
That's great. And I had a ton of mushrooms every day. I don't know how much you know about my dietary strategy, but it was very simple. And I ate the same thing every day, which was giant salads for lunch and dinner. And it was broccoli, cauliflower, kale, cabbage, red onions, peppers, mushrooms, and like a little sauerkraut on there, a little olive oil, apple cider vinegar, just some sprouted legumes, different varieties, and broccoli sprouts. I mean, just piling it on, right? It was like the anti-angiogenic super salad.
Right. Well, I mean, look, that was a choice you made based on knowledge you had. And it was a really good set of choices. And so that's what I encourage everybody to do is really, we all make choices every day in our lives to do the right thing and help ourselves and not hurt ourselves. When you're crossing the street, you look to the left and the right before just running out there. Same thing with choosing your food. Think about, what you could do and think about what you should do and make the right choice.
Well, Dr. Lee, this has been so fun. I want to be respectful of your time and just thank you for carving out an hour to chat with me and share your wisdom and expertise. It's been a real treat.
A real pleasure for me to speak with you as well. And I wish you continued success in everything you're doing.
Thank you so much. And listen, everybody, I wanted to encourage you to connect with Dr. Lee. eattobeat.org is his site, community site with loads of information and science on anti-cancer nutrition. It'll be very valuable to you. We'll put links and show notes to some of the studies that he and I have talked about, so you can look those up and read them and learn. And then hopefully, we'll find out about the next conference or conferences that are coming up, and I can share those with my audience as well as those details come together. But anyway, thanks for watching, everybody. Please like this video. Please share it. There are people in your life that need to hear this, that need to understand that your choices matter, that what you put into your body every day actually can produce health or disease, and it's up to you. So without going too long on a rant, thanks again, Dr. Lee.
Thank you.
Bye, everybody.